Okay, the final suture technique we're going to show you is the vertical mattress or horizontal mattress. I think this was the vertical that you guys use. Doctors use this in the office when they have a deep wound that has to be sutured. Deep meaning it's cut more than through the subcutaneous, and we need to collect what's deep, pull it together with the suture as well as the superficial part of the tissue or the skin. Again, remembering that suture is in a sterile container. It must be open and placed into your sterile field prior to putting on your gloves. This part inside now is considered sterile and would fall into the sterile field. From there, with your gloved hands, you can go ahead and open up the suture. Again, remembering that the doctor or dentist has ordered a certain size and texture. Again, this is 3/0 silk with a C7 cutting needle. Cutting means it will cut you too, so as you handle this, make sure that you're very careful. Remember that the little pack has a corner that says you're supposed to fold it back. When you do that, it exposes the needle. It's already set up pretty much for a right-handed physician, and you will reach in with your needle holder, leftovers, and grab it up here at the proximal end of the part closest to the suture. Pull it out to make sure that it hasn't contaminated itself by touching anything else. Again, with the tissue forceps, horizontal mattress or the vertical mattress is this way. Remember that this is a deep wound, deep incision, and it needs to collect the underlying tissues as well. So we're going to start this one approximately a ½ inch away from the wound or whatever the physician deems necessary, but it must go deep, and that's why a longer needle is necessary in this type of technique. And then we're going to bring it up through the other side. So this particular suture now has caught the underlying tissues deep, so when we pull this together, it draws the underlying tissue together as well. Now in this particular technique, even a right-handed physician needs to reverse the needle, set up for left-handed, because the second part of this now is we're going to come in with a more superficial stitch to draw the skin together when we close this. So now what does this tell you? This tells you that there are 2 strands of suture underneath this wound, and you have to be very careful because this is the one where you can really drop a stitch if you're not cognizant of it. But the vertical mattress takes on a characteristic dash effect. It looks like dashes along the wound. Again, with my general surgical scissors, open it up just minimally, cock it straight up and down to snip the tails to get good even tails. Taking this type of suture out now, again remembering there's 2 strands under there. If we can remember that everything underneath the wound needs to stay under the wound, everything on top of the wound we don't want to draw through the wound, there's a couple ways we can handle this. Generally what I do with these, and your physician or dentist may have a different technique and you need to be aware of that and follow their technique, is I'm going to cut both of these . So I've cut one of the dashes away, and simply all I have to do now is pull both of these through, and everything that came out now was underneath the wound. Did I do it too fast?